Thank you, Madam Speaker. I raised this morning on question number 87 of 2015. Excuse me. And before I ask this question to the Minister of Health and Medical Services, I also want to say my to all of my voters. Mr. Rames and Julia, the Everybody's councillors, thank you for the coming today. My question is, can the Minister inform this House what was the outcome of the Public Health Ministers' meeting held on Yanuca Island from the 15th to 17th of April this year? Thank you, Madam Speaker.
Thank you. The Honourable Minister for Health and Medical Services, you have the floor.
Thank you, Madam Speaker. The Pacific Health Ministers meeting was held on that particular date, and this was a great meeting because it was revisiting the initial Pacific Health Ministers meeting that was held in the same venue 20 years ago. And in that, one of the great major outcomes of this particular Pacific Health Ministers meeting is that the vision that was encapsulated 20 years ago is something that the Pacific Health Ministers have seen, that's something that we will continue to have. And that is the vision of Healthy Islands. And I think that is something that we can all subscribe to. In this vision of Healthy Islands, we are talking about healthy islands in which children are nurtured not only in body but also in mind, in which we have environments that invite learning and leisure, where people can work and age with dignity, where there is an ecological balance, is a source of pride, in which the oceans which sustain us is protected. Some of the major discussions that took place in that regional meeting was one that there was an appreciation that there has been some progress in infectious disease control in the Pacific. There's been some good progress in these areas, especially with reductions in areas like chronic hepatitis B infection rates, especially among young children, and the maintenance of polio-free status. That has been a great achievement in our Pacific Islands. It has been noticed across the islands that there has been improvements in child survival across the regions and also reported improvements in life expectancy. Although the gains have not been consistent across all countries, but I think that is worrying is that the rate of progress in the Pacific is not as high as the rate of progress in other parts of the world. We have, in the meeting, we have recognized that the Pacific is facing mounting health challenges with our increasing populations and aging populations. We have noticed the emergence of new diseases, such as chikungunya. We have 3 cases recently in Fiji. And while other diseases that we have had in the past, such as tuberculosis, measles and diarrhea, continue to threaten us. There has been a lot of discussions on the non-communicable disease and the impact that it's having. Our rates of non-communicable disease in the Pacific are amongst the highest in the world. And we've also had a lot of discussions on the real and potential impacts of climate variability, variations on health, and how this presents a challenge to all of us. If there's one thing that we have all agreed is that for health in the Pacific, business as usual is no longer acceptable. And as a result of this, we will be taking up the concerns of the Pacific to the World Health Assembly that will be held later on this month, in which I will be speaking on behalf of the Pacific Island nations. For that, Madam Speaker, is a brief outline of some of the discussions that transpired at the Pacific Health Ministers meeting.
Thank you.
Supplementary question, Madam Speaker.
I was pausing a little whether you were wanting to ask a supplementary question or going elsewhere. But thank you. I give the floor to you.
Thank you. Madam Speaker, can the Honourable Minister for Health explain the Ministry's immediate plans to implement the Yanuca outcomes in terms of reducing the alarming death rate of 77%, as captured in the article of the Island Business, the May issue, under the NCD or the non-communicable diseases, especially when the motion to include medicines for NCD patients in the free medicine list to avoid or control the premature deaths under NCD has not been supported. Thank you, Madam Speaker.
The Honourable Minister for Health and Medical Services.
Madam Speaker, I thank the Honourable Rondondo for her question. I think the important thing to take note about NCDs is not about fixing the problem afterwards. NCDs is about changing the way people make decisions in their life. The emphasis has to be preventive. And those concerns have been put into the annual corporate plans that we have for the ministry. We have a wellness policy. We have a wellness unit that goes out and advocates. We have put in a wellness bus that, for instance, goes out and screens people. So there are programs in place to address this. It is not something that can be done by overnight. Addressing NCDs is something that requires a whole of a government, whole of society approach, because it's about changing the way people think, about what they breathe, about what they eat, whether they exercise or not. That is the ultimate solution to it. It's not going to be in medicines. It's about all of us deciding to make that change and convincing. And that is something that we have in our plans. It's part of our annual corporate plan, and it's part of the strategic plan that we are on the verge of completing this month. Thank you, Madam Speaker.
Supplementary question. I give the floor to the Honourable Karawaki.
Thank you, Madam Speaker. Supplementary questions. I would like to thank the Honourable Minister for his statement, and very prominent in his statement is the alarming rate of NCDs that we have in the countries in the Pacific, and in particular Fiji. The question is whether the Honourable Minister understands, and if he does, whether he had advised the government that the very milk that the government is providing to all school children, especially primary school children, is one of the main contributors, the main cause of type A diabetics. Whether he knows that and whether he has advised the government. Thank you, Madam Speaker.
I thank you for your supplementary question, but I would remind the Honourable Member to be more respectful in the words that you use, particularly when you are directing it personally to a minister. However, the question is clear, and I will give the floor to the Honourable Minister for Health.
Madam Speaker.
Point of order.
The question is an inference. It's an... point of order. I did.
Order. When a point of order is being made, I expect all quiet in the House, particularly for point of order. Let us listen to this point of order.
Point of order, Madam Speaker.
Minister.
Order 44.6. The question contains an inference. The Honourable Member needs to provide statistical data to support the supplementary question he's put.
Thank you. We will. I will ask the Honourable Minister. Order. I will ask the Honourable. I'm having problem in getting her. Order, please. I will ask the Honourable Minister to provide a written answer to that question.